was walking up here, my heart is filled with gratitude. Two reasons. One, walking, taking a phone, or even holding a chopsticks can be very difficult for a rheumatoid arthritis patient. Second, I was graduated from the medical faculty of this university in the last century, and I was trained to be doctor to take care of patients with rheumatoid arthritis. A disease so common that in this room, surveys tell us that one of us or our close relatives has rheumatoid arthritis. And I'm lucky that I can do research to help my patients. The last 20 years saw a breakthrough in the development of effective drugs for the treatment of rheumatoid arthritis. The target of treatment is to reduce the joint inflammation to as low as possible and preferably to remission, just like we control blood sugar for diabetic patients. And how do we gauge the activity of rheumatoid arthritis? We need doctors to examine patients' joints and do a blood test for inflammatory marker. But the reality is that doctors cannot see patients very often. We miss what happened in between the clinic visits, and then we cannot adjust drugs quick enough. A patient assessment score has been developed in the UK based on patients' own assessments and also reporting of daily activity and simple tasks, and most importantly, without the need for a blood test. What my thesis has found is that based on patients' own assessment of the joints, they agree very well with definition of high, moderate, low, or remission disease activity. Second, the formula for the joint count, the score cannot be further reduced. And this score works very well in local Chinese patients because they may express themselves very differently from the Caucasian. And the highlight of my research is that I recruited patients from my own clinic and asked them to fill in the score every 2 weeks at home. And then using statistics, I examined all the score in between the 2 clinics and then found that they can predict the arthritis flare that's determined by doctors and also predict the doctor's decision at the clinics to step up the drugs. You may be worrying about patients exaggerating their arthritis. In fact, they tend to underreport. So this patient score can be our variable to collect big data for monitoring and then signal the patient to come forward for earlier medical attention and we doctors to see them earlier and then treat their arthritis much better. Thank you very much.